Good morning, Michael, and thank you for joining me today as we talk to leaders of Woodruff Health Sciences as well as Emory Healthcare. Michael, you've been here a few years now. First, tell us about yourself.
So I'm one of the rare people at Emory that's been here essentially my whole life. So I was actually born at Emory University Hospital when they had obstetrics, and grew up in Atlanta, went to University of Virginia for undergraduate, and then came back to medical school at Emory. Did all of my general surgery training here, which was 5 years. I was fortunate to be offered a role at Emory in Emory's Division of Cardiothoracic Surgery. For better or for worse, I was offered the opportunity to lead the division in 2017, and that's a role that I've had since.
Wow, what a remarkable journey, and clearly you're a product of the system. This is a program that has a long storied history in heart disease and innovations in surgery and non-surgical interventions. Maybe give us a snapshot of that history and obviously what lured you to come to this program.
There were a lot of firsts done here at Emory. You know, in the 80s and 90s, especially, Emory was really at the forefront of everything in the cardiovascular space. Emory was a leader in coronary bypass surgery. Obviously, percutaneous intervention was founded here with Andreas Grunzig, and there were many others after that. When they recruited Dr. Guyton to Emory, part of that support was used to start a basic science laboratory on the Midtown campus in what is now the Midtown parking deck. And that is how the Cardiothoracic Research Laboratory was started, with Carl F. Fraser support. So the Carl F. Fraser Heart Center, which is based at Emory University Hospital Midtown, has been a loyal supporter and source of philanthropy since 1980, I believe.
Michael, when one drives around Atlanta, you see other systems that highlight heart and vascular and cardiovascular care and so forth. What's our special sauce, as they say? What differentiates us in your mind?
Patients can very likely get excellent care in other places, and we oftentimes will see those patients when they need options that may not be available to them at other programs. But for us, I think the special sauce is that we have all of the options available. There's not really one area left uncovered here that we don't provide. And we're at the forefront of innovative therapies, whether they be surgical or interventional. There are things that we're doing here that are not being done elsewhere.
Michael, we hear a lot about robots. Robotic surgery, is that any better? Is the recovery faster in your world?
Most people, when they hear robotics, they think that we are adopting that platform for cosmetic reasons, to make small incisions. From the surgeon's perspective, we believe, both in valve surgery and coronary surgery, that we improve patient safety and provide better outcomes, regardless of the incision size. The exposure is better. The ability to do complex maneuvers inside the chest is improved. We see less blood loss. We see less complications from heart surgery. That's the main reason that we do it. And last year, we did over 400 robotic cardiac procedures. It represents about 17 to 20% of our overall cardiac surgery volume.
I suspect that we need the right patient.
You do, but we're pretty broad in our adoption to who we apply that procedure to. Some of the higher risk patients may benefit more from a robotic approach than the low risk patient.
Yeah, great. Maybe lastly, just talk about training here. Are we able to attract the best and the brightest to this program?
We are attracting the best and the brightest. Our training program has evolved and changed over the years. So there were different models that were adopted. We were at the forefront of that. One of them was an integrated program where we took applicants directly out of medical school into a 6-year training path. We also have a thoracic track program, so people that are interested in thoracic surgery come from general surgery and do CT surgery residency, but their focus is on thoracic surgery. and their rotations are geared towards more thoracic surgical training. We have a traditional pathway that still exists, and we also have a 4-3 pathway where somebody in
Wow.
a general surgery program can have their general surgery training shortened by a year and enter early into CT surgery
see.
training. So with all of those options, we're still very much a sought-after training destination because of the experience that's provided. We're at about 3,000 open hearts per year, 1,700 thoracic cases per year.
Does that put us in the top quartile or?
5 maybe,
Wow,
even,
wow,
is what I would guess.
that's impressive. So Michael, thank you so much. This has been great. I really appreciate your time. I appreciate your leadership. And over the next few years, I suspect we're going to be seeing even more greater things as part of the Heart and Vascular program, the CT program here. I appreciate you being with me this morning.
Thank you very much.
Great.
I appreciate it.